A statewide effort to crack down on the opioid crisis and recent pain clinics closing have many concerned about their future. As doctors and patients adjust to these drastic changes, News Channel 5's Matthew Torres explains how the whole thing could be backfiring.
It's still kind of new.
For Chantal Burke,
It's not very good for four-wheeling.
life hasn't always been an easy ride.
It's hard to do anything.
She suffers from a condition that inflicts excruciating pain to her left foot.
It's called the suicide disease for a reason, because there's nothing like it.
For years, she relied on morphine and other drugs to get her through the day. But
I ran out of meds like a month ago.
Burke was a patient at Comprehensive Pain Specialist. The company abruptly closed its doors in the state, leaving thousands of patients scared and scrambling.
I've tried calling places. One place had 3 months booked and they had a few hundred people waiting to get in.
I've had to hire extra staff.
Pain clinics like Comprehensive Pain and Neurology Center are trying to keep up. They're busy not only from patient calls, but an abundance of referrals from doctors.
Some of the practices, I understand, are actually no longer accepting any more patients. They've just been saturated.
Dr. John Schneider is also the president of the Tennessee Pain Society. With new and stricter laws limiting the number of prescriptions, he says primary care doctors are opting out and referring patients to pain clinics.
Where a lot of the primary care providers are no longer prescribing.
3 years ago, the Tennessee Pain Society says there were more than 350 pain providers in Tennessee. Nowadays, that number has been cut more than half.
It's hard to keep the grandkids off.
Luckily for Burke, she managed to get an appointment at a different clinic next week. As doctors adjust to a new normal, chronic pain patients say they're the ones caught in the middle.
And there's got to be people worse out there than me.
Matthew Torres, News Channel 5.
Matthew, thank you. CPS's CEO, by the way, was also charged with Medicare fraud. Dr. Schneider says he's trying to obtain the medical records for pain patients. Pharmacies aren't honoring some of their prescriptions given by CPS because the clinics no longer exist.